Have you ever noticed that your semen doesn't always look the same? Sometimes it's clear, sometimes white, sometimes even a little yellowish. And if you've ever wondered, does this mean something is wrong with me? You're not alone. The truth is, sperm color can tell us a lot about your health, but it's also important to know what's normal so you don't panic unnecessarily. So today, let's break it down together. I'll explain what different semen colors can mean, when it's harmless, and when it's a signal you should pay closer attention. And stay with me until the end, because I'll share the one color change you should never ignore. Let's begin with what's normal. Healthy semen is usually whitish gray or slightly milky. That cloudy look comes from sperm cells mixed with proteins, enzymes, and other fluids from the prostate and seminal vesicles. If you haven't ejaculated in a while, semen may appear thicker and creamier, while frequent ejaculation can make it look more watery. In both cases, this is completely normal and nothing you need to worry about. Now, sometimes semen looks slightly yellowish or off-white. In many cases, this is harmless. It can happen simply because of residual urine in the urethra or from eating foods rich in sulfur, like garlic or asparagus. Certain vitamins, especially B complex or vitamin C supplements, can also tint semen a light yellow. If you notice this but you don't have any pain, fever, or burning sensation, it's usually normal. My suggestion is simple. Stay hydrated, keep an eye on it, and if the color returns to normal, you can relax. But what if semen appears pink or reddish? This indicates the presence of blood, a condition called hematospermia. Sometimes it comes from something minor, like a small blood vessel breaking after vigorous activity. But it can also signal infections, prostate inflammation, or, in rare cases, more serious conditions. If you see blood in your semen more than once, don't ignore it. That's the time to consult a urologist and have it checked properly. Greenish or foul-smelling semen is another red flag. This can suggest a sexually transmitted infection or a bacterial infection of the prostate or seminal vesicles. In this case, don't wait to see a doctor promptly for testing and treatment. The earlier an infection is treated, the better your long-term health and fertility outcomes. Another variation you may notice is very clear, watery semen. Often this reflects a lower sperm concentration, especially if it happens repeatedly. While a single episode isn't concerning, persistent watery semen may point to fertility issues. Studies in the Asian Journal of Andrology have shown that semen consistency and density can correlate with sperm count. If you and your partner are trying to conceive and this watery pattern continues, it's a good idea to get a semen analysis through your doctor. And here's the part I promised to highlight. The color change you should never ignore is red or brown semen that occurs repeatedly. While it doesn't always mean something serious, it can be linked to infections, prostate disease, or even tumors. My advice here is simple. If you ever see repeated blood or brown discoloration, don't wait. Book an appointment with a healthcare provider as soon as possible. So here's the bottom line. Semen color does change naturally depending on diet, frequency of ejaculation, and hydration. But persistent yellow-green discoloration, foul odor, repeated watery semen with fertility concerns, or blood in semen should always prompt a doctor's evaluation. Now I'd like to hear from you. Do you think men worry more about the appearance of their semen or about the performance side of their sexual health? Share your thoughts in the comments because your perspective could really help another man who's too embarrassed to ask. If this video gave you clarity, give it a like, share it with someone who might benefit, and subscribe for more science-backed guidance on men's health. Remember, your body gives you signals for a reason. Pay attention, stay informed, and take care of yourself.